The value of investing in health has long been recognized. However, rising geopolitical tensions, growing nationalist populism, the impacts of climate change and the COVID-19 pandemic have all slowed health progress. So how can we reinvigorate global health? Global Health 2050, a new report by the Lancet Commission on investing in health, shows that focused health investments could drive dramatic improvements in human welfare by the middle of the century. By 2050, countries that choose to do so could reduce by 50% the probability of premature death, i.e. the probability of dying before age 70 years, from pre-pandemic 2019 levels. We call this goal 50 by 50. On average, a person born in 2019 had a 31% chance of dying before age 70 years. If the 50 by 50 goal were achieved globally, a person born in 2050 would have only a 15% chance of dying before age 70 years. Although ambitious, the goal is feasible. 7 of the 30 most populous countries are on track to meet the goal already. The 50 by 50 goal can be achieved through the scale-up of investments and services for just 15 priority health conditions, 8 infectious and maternal health conditions, and 7 non-communicable diseases and injury-related conditions together account for a very large fraction of global disparities in life expectancy. Most of the gains in global life expectancy between 2000 and 2019 were made because of declines in deaths from these 15 conditions. Unfortunately, millions of people still lack access to many basic health services. The vision of universal health coverage has advanced little in recent years, with criticism that the concept is overly broad and uncertainty about how best to implement it. In Global Health 2050, the commissioners propose a more focused approach to strengthening health systems, providing a suite of core interventions that are likely to be cost-effective and feasible to implement, grouped into 19 modules. These modules address the 15 priority conditions as well as other major demands on health systems, including rehabilitation, child and adolescent development, and palliative care. Together, they set out how countries can best use limited resources to directly improve population health and build resilient health systems. Financing investments in these services must come primarily from domestic health spending. Scaling up these interventions to full coverage by 2050 would require an additional 1% of GDP of health spending in low-income countries and an additional 2% of GDP in lower middle-income countries. There are key economic policies, primarily taxation of tobacco and unhealthy food and drinks, and removing fossil fuel subsidies, that would likely benefit health directly and generate revenue that can be used to invest in health services. Development assistance for health should focus on the 15 priority conditions through direct support to countries with the least resources, as well as through financing of global public goods, including tackling antimicrobial resistance, preventing and responding to pandemics, promoting best practices, and developing and deploying new health technologies. The world faces many challenges. It can be easy to feel overwhelmed about the prospects for global health, but the Global Health 2050 report provides a clear, achievable, feasible, and focused plan to improve health and well-being worldwide. It makes the case better than ever for the value of investing in health, for reducing mortality and morbidity, alleviating poverty and growing economies, and improving human welfare.